Any question from the audience? Please, the committee, if you can show us the question. Okay, the question is, how do we address patient clients who are dismissive or still with our approach? Any particular technique, advice from Islamic psychology perspective? Anyone want to answer? I think we will give the opportunity to Dr. Abdullah Ratman first.
Assalamu alaikum.
Waalaikumsalam warahmatullah.
Bismillah. So I think I guess the best way to answer this is what I can, from my view of what Professor Malik would say. And I think what he spoke about a lot was about connecting with the fitra, and that when you approach, remember in my presentation I was talking about, if you can't talk about the spiritual in therapy, then keep it in your own heart. And so this approach to psychotherapy from an Islamic perspective or an Islamic paradigm is about how we approach the notion of healing, the notion of health, and the technique of the approach is really grounded in our orientation to that paradigm and our own orientation in our own heart to how we're holding the client's heart. And so it's not necessarily about the language that we use. It's not necessarily about speaking about religious concepts or overtly talking about Islam as a belief system, but it's understanding that as believing Muslims, we believe that this is the way, this is the paradigm, this is Allah's reality, and that health and healing and the process that we're trying to do in psychotherapy to help the client is really at the core about plugging them in to that healing reality through aligning the client with their fitra, meaning just the natural aspect of being a human being and recognizing that that reality of the human being is that it is in witnessing and submission to Allah. Now, whether or not the client or the system that you're working within recognizes that and uses the language around religious orientation is only, all that it does to not use that language is just, it makes it a little bit more veiled. Like you can't overtly talk about these concepts with the Arabic terminology and the religious framework, but that doesn't take away from the fact that what works is fundamental to how human beings work. And so I think the way to deal with, as the questioner said, people who are hostile to it, I think Professor Malik would say, well, don't even go there. Don't even allow them to be hostile, because at first you should just start with the mercy and the leniency and the gentleness. So it's not about coming in and saying, well, this has to be in this framework. You have to understand Islam. You have to be a believer. You just accept the person as a human and help that person get in touch with their ultimate fitra as a human, and that this is how you sort of get underneath any resistance or difficulty with this religious paradigm, and basically just, it doesn't have to be that way. It can be approached from a much more accessible way, depending on the context and the people. Allahu A'lam.
Thank you very much. The most important thing is touching the fitra and presenting us as a very, very good Muslim psychotherapist, inshallah. Any more questions, sister, brother and sister? The committee, do you have more questions? Or anyone want to speak directly? We also can take questions.
I just want to greet Dr.
Okay,
Olga.
bagus. Okay.
It has been 2 years, and I remember that we have a plan to have the course from the Eastern Psychology Department. So how is it doing right now? I just want to ask about the program. Thank you.
Thank you. Dr. Olga, maybe you want to explain? Hello, Dr. Olga. Hello, hello. Maybe Dr. Olga is having a connection problem. Any more questions from the audience?
There are more questions. Mrs. Diana, I will share screen again.
Okay, please. To Dr. Abdullah Ratman. Assalamualaikum. I am Hana Permata Hanifah. Is there any assessment instrument to be used before doing Islamic counseling psychotherapy to the client? If I want to start doing this on the school as a guidance or counseling teacher, whom I have to consult the professor looking for advice for doing this better. Please make dua for me. Okay, please, Dr. Abdullah Ratman.
Assalamualaikum.
Waalaikumsalam.
In terms of the instruments, there are. I personally don't use any in particular, and so I can't speak to any specifics. But there are quite a few instruments that have been developed over the years, and we have in 2016, myself and Dr. Amber Haq and Human Kashavarzi and Dr. Fahad Khan published a paper through the Journal of Muslim Mental Health. And in that paper, there's a pretty exhaustive list, at least at that point, of the assessments that have been developed in this field. So I would refer you to that for that, and there's been more that have been developed. But in terms of the second part of your question of how to get guidance and training, I think it was, for doing this as a school counselor, there's more and more programs coming out, and I advise that you get training. This is, it's great to learn on your own, and sure, assessments, really, instruments can be helpful as tools when you already have an orientation and training in how to use them. Otherwise, they can become problematic if they're not grounded in a larger context of understanding how to use it as a tool. Because what you wouldn't want to do is sort of, like I was saying, is Professor Malik's approach was never about implementing a theory. It was about understanding the entire context. So he was well versed in Islamic studies. He was well versed in the whole field of psychology, psychotherapy, experimental psychology, like everything. And he was pulling and integrating. And so it's really important that you have a wide education to pull from, and that you don't just sort of, it's not about learning a technique and applying a technique. It's really much broader than that. And so I would say, look for education. There's more and more programs coming out. There's one in Australia, there's one in Pakistan. So Dr. Hanan Dover you could reach out to her. There's also Dr. Hussein Rasool. There's a program in Pakistan. We have a program at Cambridge Muslim College. There's the Islamic Online University. So there's more and more opportunities to get an education. So I highly recommend going that route and not trying to necessarily piece it together on your own. There's a lot of resources, particularly with the professionals and scholars in this conference that you can lean on for support, inshallah.
Okay, thank you very much. Prof. Rasul, do you want to add something about this, or maybe you want to explain about your program? Hello? Maybe Prof. Rasul is not here anymore. Okay, maybe we will take another question from Brother Misbah Rafiq. Please welcome.
Assalamu alaikum.
Oh,
Hello.
okay. Okay. Hello. Waalaikumsalam warahmatullahi wabarakatuh.
My question is that as was the presentation of Professor Riano as well and others, so where we are just where it was just said that we cannot ignore, and what Professor Malik Badri had also recommended, that we cannot ignore the contributions of the Western psychology and the underlying principles out there, but then we have to incorporate them with the Islamic principles. But my question is that if we just can we just lift that that idea for some time, just delve deep into the Islamic literature, and then find, maybe we come up with something new, and then we maybe at a later stage we relate it to what is in the existing literature. But when we go into the literature, when we go into the Quran without any preconceived presumptions of the Western mainstream psychology, and maybe we come up with altogether new framework. And so can we just bracket our pre-understanding about psychology, because we are all trained in psychology, and just go into the literature and see what new arises from there. And that is, I think, what was called for by Malik Badri as well. He actually supported the idea of emancipatory approach. And how far can we actually go into that and stress that, rather than just working on the integration only and work towards indigenization? I would want any of the speakers in the panel to just elaborate on. Thank you.
Okay, thank you very much. Prof. Tahir Khalili, do you want to answer the question from Sister Ms. Rafiq? Hello.
Thank you. Yeah, thank you very much, Dr. Diana. And I think it's a very important question. We need a profound understanding of the Islamic psychology, and we need to read more and more about our previous scholar. One of my students, I will just mention to you, you were talking about the instrument, and now he's doing his PhD, and his main focus is on the development of melodies of the nafs scale. We are trying to investigate objectively through an instrument which is having psychometric properties, and then we are trying, and we are using the same method which the other psychologists in the other words they are using for the development of instrument. then inshallah it will get in a year. This will be published, and that will come, and then the psychologists can use that melodies of the nafs to investigate the melodies of the nafs. I think one of the scholars, I think Professor Ghuram Rasool has mentioned that Malik Badri, Professor Badri was creative. That's why I took this other topic, which was very relevant and which I found in his literature. He was creative, he was all-rounder, and he covered many areas. It's not just the only, we can say, the psychology. That was the main subject of his interest. But he also was well versed in religion, and even in the practical aspects of religion. It's not just the spiritual aspects, but he was trying to integrate both the spirituality and institutionalized religion. That is the religion which is available in the institution. And he was trying to integrate these two. I think his work need more contemplation and more exploration like he did. And I think now it's open, and I think we have these association, and we expect from them that they will bring all people together. We shouldn't have some exclusive ideas, but we need collective wisdom, collective approach, because Islam also promote collectivism, to have a collective wisdom. Then I think there should be, we need to develop uniformity. We need to have epistemology which is acceptable to majority of the scholars and Muslim who are working for Islamic psychology or psychotherapy, or we don't need to put ourselves in differences, rather to integrate all the approaches, and to have this respect. Like you have seen the Western world, they have differences, but they have a great respect for each other, and they have a compassion. Then we also need to have this, adopt this approach that was Malik Badri taught us. And I think this is the way that we will be creative, and at the same time we integrate and we develop some collective wisdom, collective epistemology, that the people have this uniform level of knowledge.
Okay, thank you very much, Prof. Tahir Khalili. I think we will take the latest question. Please, the committee to show up the question. To Prof. Hussein Rasul. We will check if Prof. Hussein Rasul is still with us. Hello? I think it's not with us anymore. So maybe the next question, the other question. Okay. To Dr. Olga. Dr. Olga is staying with us. Hello? Is there another question? I think Prof. Tahir Khalili can answer the question.
Okay, I will just try my best to answer the question first. The first one, the trauma one.
The first one,
yeah,
the
okay.
trauma. Because
I
you
think
are also,
EMDR is a known therapy for trauma. Those who are suffering from a traumatic experience, particularly the PTSD, post-traumatic stress disorder. But there are certain other therapies as well, like narrative exposure therapy, which is very near to our cultural and religious perspective, like the person narrate his story of his life. And there are some other approaches like neurofeedback, the alpha theta, that is also a treatment for the trauma, those who are experiencing PTSD. then I think the Islamic psychotherapy, maybe we should try to develop or integrate the same approach. And usually in our culture, in Pakistani culture, the people tell us the stories of their lives. And once they tell this story in an environment, which is a therapeutic environment, then they convert that hot memory into cold memory. Because we cannot remove that from our memory, that is a part of our memory system, but that become cold rather than remain hot, which is all the time is burning and creating problem for you. Then I think that is the narration, that storytelling in a narrative form, that could be helpful for the EMDR is an activity. You can do it, and you can use any other behavioral techniques. It depends upon your cultural environment and the belief system. But usually when we borrow the exact model from the other culture, then there are some hardship, there are some difficult things to adopt, because there are some cultural differences and even belief system. Then I think we need to indigenize certain therapeutic treatment approaches, and then we can utilize that. And that will be helpful rather just to borrow the same thing and utilize it. Then I think I work in both culture, in the Western culture and in this culture. It's very hard to do it, and it's very hard to borrow the same thing and to copy in the culture. But I think we need to indigenize and adopt that model to our own, for our own treatment strategies.
Okay, thank you very much, Prof. Tahir Kariwi, for answering the question about the MDR. I think it is very late here in Indonesia and of course in Australia as well. So we will close this session and we'll continue the discussion tomorrow. Inshallah, tomorrow we will start at 3:30 Indonesian time or 8:30 UTC GMT with paper presentation. And on the 7 p.m. or in Indonesian time or 12 GMT, we will have very interesting session to discuss about the Malik Badri's book. Yeah, and we will also involve Dr. Rania Awad from California in the very late session. Thank you very much for coming.
Thank you very much, Dr. Diana.
Yeah.
And I think we should pray for the
yes.
late Malik Badri. Allah may give him a high place in Jannah.
I
think we hope that he will be in Jannah, inshallah.
Assalamu alaikum. Inshallah. Thank you, Dr. Abdullah Rahman. Thank you for all the speakers. And thank you for Dr. Olga. It's okay, but your presentation, everyone is amazing and give us inspiration to continue the legacy of Prof. Malik Badri. Thank you, everyone, and inshallah we will see you tomorrow. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Dr. Diana.
Yeah, thank you very much.
Pak Bagus.
Yo, assalamualaikum.
Waalaikumsalam warahmatullahi
Assalamualaikum warahmatullahi wabarakatuh.